Part 1, Introduction. Mental health e-screening tablets present mental health assessments to newly registered veterans who are willing to begin their initial data entry while still in the VA waiting room. The tablets capture veterans' data securely and confidentially. Meanwhile, MHE provides a dashboard for clinicians to view ongoing assessments, which track veterans' progress overall and highlights those veterans who need assistance to complete their assessments. The MHE dashboard shows a real-time alert for any responses that exceed warning parameters, such as suicide indicators. This allows clinicians to single out and fast-track veterans who may be undergoing a crisis, but not displaying the outward signs of it. For the last 2 years, the Center for Excellence in Stress and Mental Health has been using e-screening for veterans enrolling in VA healthcare in San Diego. About half of the newly enrolled had risk factors for suicide, indicating the need for immediate clinical follow-up. Many veterans had symptoms of depression and anxiety, and the majority were in physical pain. Findings from this research pilot indicate that tablet-using veterans have their screenings documented an average of 19 days sooner than veterans who use paper forms. Almost all of the tablet-using veterans who wanted help were able to speak with a clinician within 3 days versus 2 to 3 months with the old system of paper forms. MHE was preferred by both the clinicians and the veterans. From this study, we are able to reach a number of conclusions both in clinical care and administrative benefits. Timely triage to appropriate services. Approximately 40% of the veterans need immediate follow-up with the suicide risk assessment. The ability to monitor treatment outcomes over time. Increased encouragement of veterans with immediate personalized feedback. Greater overall veteran satisfaction due to an increase in trust. Administrative benefits include increasing screening capacity, improved capability to monitor ongoing treatment outcomes, reduced time needed for clinical care and documentation, and increased quality of care without increasing staff. We will now view a sample assessment that a veteran might be asked to complete to see what the veteran will actually be doing with the tablets. On the opening screen, the veteran first needs to sign in by entering their last name and the last 4 digits of their Social Security number, and then they click on the Login tab. At this point, you have the introduction screen. You can customize this to put on different messages depending on which you require. This is done by the administrative staff, but the key here is to click on the Start Assessment to begin taking the assessment. At this point, you are taken through the modules that have been requested by the clinician for the veteran to answer during this review. On the left side, you can see the different sections that you have questions in, and you can see the menu bar here will show as they complete each section, each module in the section, exactly what their progress is. There are a number of different question types. In this first screen, we just have text entry bars and a drop-down selection bar. And they would go from screen to screen. As you answer the questions, follow-up questions based on your answers will appear on the screen. Here you see radio buttons and text entry fields. And you can see on the left side, the completion percentage is changing as we go through these screens. If the veteran tries to go on to a subsequent question without completing it, they're given a warning message, and they can either proceed or they can stay on the current page. If it's required questions they are skipping, then it will not allow them to proceed. Again, different questions are added based on your responses. In this case, we're having multiple windows open to enter data. I can skip to a different section just by clicking on the section on the left. I've gone back and to a question I've already answered, and I can change my questions based on that. And now I'm jumping to the last part. You can also have matrices of questions. And again, based on the veteran's responses, alerts may be generated to warn you of a veteran who is in stress or needs to see a clinician right away. And finally, we reach the final page, and the veteran at this point would say they're finished with the questionnaire and return the tablet to the clinician or the staff. Note that these assessments can become quite involved. What we just showed you was a very brief one. Here's one with all the questions that could possibly be answered. And you can see there's a number of modules in each section that can be answered for the user to respond to. And we'll show you this in the next videos as to how to go in and set up a basic assessment for the veteran and what questions you want to have the veteran